I'm Dr. Antoni Chan. I'm consultant rheumatologist and physician at the Royal Berkshire Hospital in Reading and also at the Spire Dunedin Hospital in Reading. I see patients with general rheumatic conditions and also patients with general medical conditions. Lupus is a chronic autoimmune condition which can affect patients, and it can present in a host of different ways, including joint pain, skin rashes, and also internal organ involvement. It is a diagnosis that can sometimes be complicated by features that may look like other conditions like infections or hematological conditions, and therefore clinical assessment is very important in order to make a diagnosis of lupus. The main causes of lupus are not known because there is probably a host of reasons or factors that may cause lupus. Lupus can sometimes be limited to the skin. We call that cutaneous lupus, or it can have a more generalized systemic form. We call that systemic lupus erythematosus, also known as SLE. When studies have been done looking at causes, there are a few factors that need to be considered, including genetic causes, hormonal causes, and also environmental causes. And there are probably around 100 genes that are involved in the predisposition towards lupus. What we do know that there is a higher number of females that have lupus compared to males, somewhere in the ratio of 9 to 1. And that is probably due to the hormonal changes that are different between males and females. Finally, there are also environmental causes that can also contribute to the development of lupus. Lupus can present with a host of different symptoms. They can be generalized symptoms such as fatigue, tiredness, fever, and also some more specific organ-related symptoms. Uh, this could include skin rashes, itching, and also pains in the joints. In patients who have more systemic forms of lupus, there can also be other symptoms, including shortness of breath, difficulty breathing, a history of having blood clots, and also pain in the stomach or pain in the abdomen, and also some difficulties with walking, for example, due to muscle involvement. Lupus can be mild, moderate, or severe. So depending on the clinical assessment, there are some forms of lupus that can be milder or more limited, for example, just to the skin or joints, to those that are more moderate with some involvement of one or two organs, to the most severe form where there are multi-organ involvement and these patients will need more support and more treatment. There can also be other complications affecting the organs such as the lungs, kidneys, or heart. And therefore, it's very important to assess because each individual or each patient will be very different. And so the treatments will be specific for those conditions. Clinical assessment is really important in terms of choosing the treatments for lupus. When we assess our patient, we want to know the degree of activity, and this could be done by clinical examination and also blood tests, and also the organs that are involved. The treatments will then be chosen according to the level of involvement from the condition. And so there are treatments from mild, moderate to severe. These treatments include topical treatments that could be creams and that we could apply on the skin to more systemic treatments or tablets. These include antimalarials such as hydroxychloroquine and more immunosuppressive drugs such as azathioprine, mycophenolate, and also prednisolone. In more severe cases, there may be other treatments such as cyclophosphamide, and also the new advance would be biological treatments such as rituximab and belimumab. There are also now more clinical trials looking at more agents, and therefore the hope for treatments in the future in lupus are starting to become brighter. And this will be good news for our patients because we have more treatment choices to offer our patients in the future. Lupus is a condition that can cause flare-ups. In between times, patients can feel relatively quite well and stable, but it's quite clear that they often get flare-ups. And so it is important to try to maintain what we call remission of disease. So when a patient has an active disease, we would treat the patient quickly in order for us to lower the disease activity. And patients will have to stay on some treatment, but able to continue with their daily activities and continue with their daily function while they remain on treatment and monitoring. This is the way for us to reduce the number of flare ups patients have and to reduce their symptoms in the long term.